Cancer alert. Your body has its own warning system, and sometimes it doesn't speak in pain. It speaks in sound. A cough that won't quit. A gurgle that shouldn't be there. A voice that just changed overnight and never changed back. Most of us are trained to notice pain. We are not trained to notice sound. And that is exactly why doctors say these 10 sounds are the ones people miss, again and again, until it is too late to catch things early. In the next 15 minutes, we are going to walk through 10 sounds your body can make. Sounds that seem harmless on the surface, the kind you would normally shrug off in a waiting room or laugh about with a friend. But doctors say these same sounds, when they follow a certain pattern, can be some of the earliest clues the body gives before anything shows up on a scan. Some of these you have probably heard before and brushed off without a second thought. Some of them might surprise you completely. Stick around until the end because number 7 is the one almost nobody has ever heard of, and it is the one doctors themselves say is the easiest to miss. Sound 1, the cough that won't go away. Everyone coughs. Colds, allergies, dust in the air, a sip of water that goes down the wrong way. But there is one kind of cough doctors pay very close attention to, a dry, persistent cough that lasts more than 3 or 4 weeks with no clear cause. Not the kind tied to a cold that fades in a week, the kind that just stays quietly in the background of your day, so long that you almost forget it was ever unusual. In some cases, a lingering cough like this has been linked to early lung changes, including growths that irritate the lining of the airway just enough to trigger a reflex. It does not mean every long cough is cancer. The vast majority are not. Most turn out to be acid reflux, a lingering virus, or simple irritation. But doctors say a cough that overstays its welcome, especially one paired with unexplained fatigue, shortness of breath, or weight loss, is one of the clearest signals worth getting checked, rather than waiting it out for another month. Sound 2, a voice that suddenly changes. Hoarseness happens to almost everyone occasionally. Too much talking, a bit of a cold, dry air, a late night at a concert. But when your voice changes, and stays changed for more than 2 or 3 weeks, with no obvious reason, that is a completely different story. A persistent change in pitch, breathiness, or roughness can be tied to changes in the vocal cords or thyroid, which in some cases are early indicators worth investigating properly. Singers, teachers, and public speakers are often the first to notice, simply because they know the exact sound of their own voice better than anyone else. If your voice suddenly sounds like someone else's, and weeks go by without it returning to normal, doctors say it is worth a conversation with an ENT specialist, not another few weeks of waiting to see if it clears up on its own. Sound 3, wheezing without a history of asthma. Wheezing is usually associated with asthma or seasonal allergies, something people either grew up with or expect during pollen season. But new wheezing that shows up in adulthood, in someone who has never had breathing issues before, is a different story entirely. This kind of wheeze can happen when something inside the airway, sometimes a growth, partially blocks normal airflow, creating that faint whistling sound every time you inhale or exhale. It is one of those symptoms that is incredibly easy to dismiss as just getting older, probably allergies, or maybe I need more exercise. Doctors say new, unexplained wheezing that does not respond to typical allergy treatment, inhalers, or time is worth flagging clearly to a physician, especially in current or former smokers, where the stakes of ignoring it are even higher. Sound 4, a gurgling or rumbling stomach that won't settle. Stomach gurgles are completely normal. It is just digestion doing its job, gas and fluid moving through the intestines. But constant, unusual gurgling paired with other changes, like unexplained weight loss, feeling full after just a few bites, or ongoing bloating that never fully goes away, is a very different pattern. In some cases, this combination can point to a blockage or obstruction somewhere along the digestive tract that is slowing everything down. On its own, a noisy stomach means absolutely nothing. It is the combination that matters. The sound, plus the pattern, plus the timeline, all lining up together. That is exactly the kind of clue doctors are trained to piece together during a careful history, and exactly what most people never think to mention out loud at a routine checkup, because it feels too minor to bring up. Sound 5. Clicking or popping joints with swelling sound. Joint clicks and pops are usually completely harmless. Tendons shifting slightly, small air bubbles releasing in the joint fluid. Nothing remotely concerning. But when a clicking or popping sound is joined by localized swelling, persistent pain that does not fade, or a lump that simply does not go away over several weeks, that combination is far less common and far more worth investigating properly. In rare cases, this specific pattern has been linked to bone-related growths that change how the joint moves and sounds. This is one of the least talked about warning signs on this entire list, simply because clicking joints are so universally common that almost nobody connects them to anything serious until the swelling shows up too, and by then, weeks or months may have already passed. Sound 6. Persistent hiccups that last for days. Hiccups are almost always a complete non-event. They show up out of nowhere. They annoy you for a few minutes. Maybe you hold your breath or drink some water, and then they disappear just as suddenly as they arrived. But hiccups that last more than 48 hours, especially in adults, are considered a genuine medical red flag, not just an inconvenience. Prolonged hiccups can be connected to irritation near the diaphragm or esophagus, and in some documented medical cases, that irritation has been traced back to a growth pressing on the nerve that controls the diaphragm's movement. Most people treat long hiccups as a funny story to tell at dinner, something to laugh about with coworkers. Doctors treat them as a very real reason to ask more questions, run a few tests, and rule things out early. Sound 7. The crackling sound when you breathe. This is the one most people have genuinely never heard of before. A fine, crackling sound in the lungs, almost like stepping on dry autumn leaves, that shows up specifically during inhalation. It is usually only detected with a stethoscope, pressed carefully against the back or chest, which is exactly why it flies completely under the radar for so long. You cannot hear it in the mirror. You cannot feel it. This crackling can be caused by fluid buildup or abnormal tissue changes deep in the lungs, and it is one of the subtler signs doctors are specifically trained to listen for during a routine chest exam. You will not catch this one yourself, no matter how closely you pay attention to your own body. But it is precisely the reason regular checkups still matter so much, because a trained doctor's ear can catch what you never would, no matter how health conscious you try to be. Sound 8. A chronic throat clearing habit. Clearing your throat now and then is nothing at all. Dry air, talking too much during a long meeting, a bit of post-nasal drip after a meal. But when throat clearing becomes a constant, almost unconscious habit that lasts for weeks on end, paired with a persistent scratchy or tickling feeling that never fully resolves, doctors pay much closer attention. This pattern can sometimes be tied to changes in the throat lining or the vocal cords themselves. Most people label this just a habit, blame it on allergies, dry office air, or acid reflux for months, sometimes even years, before ever mentioning it to a doctor at all, simply because it feels too small and too embarrassing to bring up. Sound 9. Unexplained. Snoring that starts suddenly in adulthood. Snoring on its own is extremely common, and in most cases, it is nothing more than an annoyance for a partner sleeping nearby. But new loud snoring that appears suddenly in someone who never snored before in their life, especially when it is paired with difficulty breathing through the nose during the day, or a noticeable change in voice, can sometimes point to a blockage slowly forming in the nasal passage or throat. It is incredibly easy to blame new snoring on weight gain, getting older, allergies, or simply sleeping in a new position. Doctors say if it comes on suddenly, does not fit your usual pattern, and sticks around for weeks, it genuinely deserves a second look rather than a shrug. Sound 10. A high-pitched whistling sound when breathing through the nose. This last one is subtle, and it is very often mistaken for nothing more than a stuffy nose. A consistent high-pitched whistle when breathing through one nostril specifically, one that does not clear up with decongestants, allergy medication, or simply waiting it out, can indicate a narrowing somewhere in the nasal passage. Because it feels so similar to a common cold or a routine sinus issue, this particular sign often gets ignored for months at a time. Doctors say if the whistle is clearly one-sided, persistent, and does not respond to anything you try, it is one of the easiest easiest and most overlooked signs on this entire list to actually check, often with a very simple examination. None of this means every sound is a diagnosis, and none of it means you should panic over a single cough or one night of snoring. Most of the time, these sounds are nothing at all, and that is worth remembering. But doctors agree on one thing consistently: the sounds that last, that repeat, that do not fit your normal pattern are the ones worth mentioning out loud, clearly, to someone who can actually check. So to recap everything we covered: a cough that lingers for weeks, a voice that changes and stays changed, new wheezing with no history of asthma, an unsettled stomach paired with unexplained weight loss, clicking joints accompanied by swelling, hiccups that last for days rather than minutes, a fine crackling sound in the lungs that only a doctor can hear, a chronic throat clearing habit that never fully resolves, sudden new snoring in someone who never snored before, and a persistent, one-sided whistle when breathing through the nose. On their own, each of these is usually completely harmless. Together, and especially when they overstay their welcome for weeks rather than days, they are exactly the kind of pattern doctors are trained to catch early. If any of these sounds like something you have brushed off before, that is not something to panic about right now. It is simply something worth getting checked, just to be safe, just to rule it out. Drop a comment and let us know if any of these surprised you, especially number 7, the one almost nobody knows about. And if you want more videos breaking down what your body is quietly trying to tell you long before anything shows up on a test, make sure you are subscribed.